Feline panleukopenia, or feline infectious enteritis, is a serious disease that can pose a danger to your beloved cat. This article will introduce you to the symptoms, causes, diagnosis, and treatment options for this disease so that you can better care for your pet. Part 1. What is feline panleukopenia? 1.1 Definition: Feline panleukopenia is a blood disorder that results in a decrease in the number of white blood cells in cats. White blood cells are an important part of an animal's immune system and are used to fight off foreign pathogens. When a cat's white blood cell count decreases, its ability to resist infections will be weakened. 1.2 Types and functions of white blood cells. White blood cells are divided into 5 types, including neutrophils, eosinophils, basophils, lymphocytes, and monocytes. These white blood cells have different functions and work together to maintain the health of the animal. Part 2. Symptoms of feline panleukopenia. 2.1 Common symptoms when a cat is infected with feline panleukopenia. It may exhibit the following symptoms: fever, weakness, loss of appetite, rapid breathing, diarrhea, and bleeding. These symptoms may worsen rapidly over a short period of time, leading to serious health problems. 2.2 Precautions: If your cat exhibits the above symptoms, you should seek veterinary care as soon as possible. Feline panleukopenia can lead to serious complications such as sepsis, pneumonia, and peritonitis. Part 3. Causes of feline panleukopenia. 3.1 Congenital factors. Some cats may develop feline panleukopenia due to congenital factors. For example, certain gene mutations may affect the production of white blood cells, making cats more susceptible to the disease. 3.2 Viral infections. Feline panleukopenia can also be caused by viral infections, such as feline leukemia virus, FeLV, and feline immunodeficiency virus, FIV. These viruses can destroy a cat's immune system, leading to a decrease in white blood cell count. 3.3 Drugs and toxins. Certain drugs and toxins may also cause feline panleukopenia. For example, some antibiotics, anti-cancer drugs, and chemicals may have a suppressive effect on white blood cell production. 3.4 Autoimmune diseases. Some autoimmune diseases may also cause feline panleukopenia. In this case, the cat's immune system mistakenly attacks its own white blood cells, leading to a decrease in their numbers. Part 4. Diagnosis of feline panleukopenia. 4.1 Blood tests. Veterinarians will perform blood tests to determine if a cat has feline panleukopenia. By measuring the total number of white blood cells and the ratio of different types of white blood cells, veterinarians can assess the cat's immune status. 4.2 Virus testing. To determine the cause of feline panleukopenia, veterinarians may perform virus testing, such as FeLV and FIV testing. This can help determine the type of infection and take appropriate treatment measures. 4.3 Other tests. Based on the cat's symptoms and medical history, veterinarians may also recommend other tests, such as X-rays, ultrasound examinations, and bone marrow biopsies, to assess the cat's overall health. Part 5. Treatment of feline panleukopenia. 5.1 Supportive therapy. For feline panleukopenia, veterinarians may provide supportive therapy, including fluid therapy, nutritional supplementation, and medication to alleviate symptoms, to help the cat recover strength and resist infection. 5.2 Antibiotic treatment. If feline panleukopenia is caused by bacterial infection, the veterinarian may use antibiotics. Depending on the type of bacteria, the vet will choose the appropriate antibiotic and adjust the medication plan according to the cat's response. 5.3 Antiviral treatment. For feline panleukopenia caused by viral infection, the veterinarian may use antiviral drugs. These drugs can suppress viral replication and slow the progression of the disease. 5.4 Immunosuppressive drugs. If feline panleukopenia is caused by autoimmune disease, the veterinarian may use immunosuppressive drugs for treatment. These drugs can suppress the immune system's excessive response and reduce the attack on white blood cells. 5.5 Preventive measures. To prevent feline panleukopenia, you can take the following measures. Regularly take your cat for checkups to detect abnormalities early. B. Vaccinate your cat to reduce the risk of infection. C. Maintain your cat's living environment hygiene and reduce the breeding of pathogens. D. Avoid letting your cat come into contact with toxic substances and items that may cause allergic reactions. Conclusion: feline panleukopenia is a serious disease that requires our close attention. Understanding the symptoms, causes, diagnosis, and treatment of feline panleukopenia can help you better care for your pet. If your cat shows relevant symptoms, please seek medical attention promptly and follow the vet's advice. In daily life, developing good pet keeping habits and regularly conducting health checkups for your cat is an effective way to fight against feline panleukopenia. At the same time, actively preventing and controlling viral infections, avoiding letting cats come into contact with toxic substances and allergens, will help reduce the risk of feline panleukopenia. As a cat owner, maintaining good communication with the veterinarian, closely monitoring changes in the cat's condition, and following the vet's advice for treatment are essential. Taking care of a sick cat may be a difficult process, but with effort and patience, you can help your beloved cat get through this difficult time and regain their health. Finally, sharing your experience and knowledge with other cat owners and pet enthusiasts will also play a positive role in raising awareness and prevention of feline panleukopenia. Let us work together to protect the health of our cats.